My name is Sassy Sylvia and I'm from the Global Road Safety Partnership. And a topic or an issue that lacks attention and interest from a lot of people, not only here, but also from where I come from. From your introduction, I am glad to know that some of you are actually doing something in the interest of road safety. We don't have to do huge or big projects to make an impact. All we need is to start somewhere, have that interest to want to do something to save someone's life, to save our lives. And that effort and initiative will go a long way towards contributing towards reducing the road traffic death and injuries. So I will start with a brief introduction about the worsening problem of road traffic crashes. Every 30 seconds, one person is killed on the road. Every year, 1.2 million people die on the world's road, which is about 3,287 deaths in a day. That's not all. 20 to 50 million more suffer non-fatal injuries and are left physically disabled. And according to WHO, this 1.2 million number is similar in number to the deaths caused by communicable disease. So road traffic crashes have become a disease. It is a growing epidemic. It is a public health concern. And if we look at this chart, if none of us do anything about road safety in the little means that we can, by 2.4 million more people, and it will become the 5th leading cause of death. Now this is tragic, is a disaster, but it is something that each and every one of us here can do something about. They are the hardest hit. More than 90% of the world's road traffic deaths occur in these countries, even though they have less than half of the world's registered vehicles. Now, however, research and data reveals that almost half of those who die on road crashes are pedestrians, bicyclists, motorcyclists, and passengers of road transport. They are vulnerable road users. Some of us have been involved in crashes. Some of us have heard and shared the story of those who have been involved in crashes. And we know the plight. The impact is most striking among the young. Road traffic crashes is the leading cause of death for those aged between 15 to 29, and the second leading cause of death for those aged 5 to 14. This age group 5 to 14, our youngsters, our little ones, they are vulnerable road users. They are pedestrians, they are walking, they are bicycling, and they share the same road with other vehicles. They are exposed to the risk. And then we also have the young and novice drivers who have just obtained their driving license. This privilege that they have just gained. They engage in risky behaviors that not only endanger themselves but the people around them. Therefore, the impact is almost striking in these young people. The impact of road crashes is not only limited to the individual. Work with the community, the economic, the national health system. All these are left affected because of a road crash. Annual costs of road traffic injuries in low and middle income countries have gone over $65 billion if it is not going towards road traffic injuries. What can we do? Sorry? Provide faster emergency response. But unfortunately, because road traffic crashes keep increasing, the cost is spent there. Now the pain and suffering, besides the enormous pain and suffering, now the families actually have to suffer because of the long-term consequences. People in poor and their family have to go through the medical costs, the rehabilitation, looking after someone with physical disabilities, someone who has lost their limbs. If there is death, we have cost of funeral. And then we also have loss of income, the loss of a breadwinner. Therefore, if an average family struggles, can you imagine what is going to happen with poor families? Now, low and middle income countries, in these countries, 30 to 85% of trauma hospital admission are road crash victims. So from this brief data we see, more than 100,000 could be people we know. It could be our children. It could be our friends. Okay? Key contributing factors of a crash. What causes a key risk factor? What else?
Drinking.
Drinking, driving. Do we have anything else?
No teaching about
driving license without underage.
Underage driving, exactly. What else?
no teaching about the road safety rules.
No, lack of education.
Lack of education.
Yes, lack of road safety education.
Bad road engineering.
Bad road engineering. Yes, same. Right. Okay. So we know there are many factors that contribute to crashes. Ready? I used to speed.
Yes, occasionally.
Occasionally. So why do you speed?
Sometimes, not exactly, maybe
Time
shorter time.
Time factor. It's thrilling. Coming from you, it's thrilling. Okay. There are many reasons why people want to speed. But just 20% of a crash that causes death. Okay? And as a pedestrian, how many of us walk? All of us walk, although we are drivers. If a pedestrian is hit at a speed of 35 kilometers or less, so that 90% is gone automatically. If a pedestrian is hit at 45 kilometers per hour or more, he only has less than 50% chances. Now I ask you, if your family, do you want to drive at such a speed?
No.
No. The decision lies in our hands. There are many key risk factors. We've talked about drink driving. We've talked about speeding. It's not working. People know, or they are just ignorant of the fact that just using the helmet can increase your survival rate, can help to reduce your injuries. And then but there are many people who are either ignorant about it or they do not know about it. The good news is that today, each and every one of us can do something within our means from where we come from. If I were to ask you, a risk factor is speeding, who decides to speed? Is it you behind the wheel? Who decides not to use the seatbelt? Yourself. Who decides to not maintain their car? You. So these are behaviors of us individuals which actually contributes to crash. Therefore, if I ask you, can you prevent these behaviors? Yes, we can. Now let's do something about the road system. None. This is beyond our control. We need the policy makers, the decision makers to come in. We need the road safety council to come in. We need the engineers to come in. So these are factors. Properly transportation, enforcement. We know that effective enforcement creates a force towards the people to want to. Then we have problems like we can make a difference within our own means. Now if we look, that there's something needs to be done. And in some cases when the problem has been identified, good practices are not being implemented. What we mean by good or best practices? We look at tried and cannot just plug them and bring it over here in India, in Jalandhar, and expect it to work. It needs to be adopted, it needs to be mended, it needs to suit the culture, it needs to suit the data, the problem, and the people. And often, when we have identified the problem, we have identified the best practices, capacity building, we need the government's support. it is very important that we try to garner support from the people on top. We need their coordination, we need their management to prioritize a safer system. What I mean by safer system is that the road vehicle and the environment. So a safe road traffic system approach is one that actually accommodates and complements, because our human body is highly vulnerable to injury, and we humans make mistakes. How many of you have made mistakes on the road? Only one. Everyone, we make mistakes. Sometimes we tell ourselves, I get in the car, 3 minutes down the road, your mind is wondering about something else. You're bored with the music coming from the radio, and you look for a CD to change. That's why we need to be reminded. If I'm traveling with you, a fellow friend, it is your responsibility to bring me home safely, and it is my responsibility to encourage you to do what is right on the road. That is what we want to tell people to do. Road safety is everybody's response, and every one of us. And then, we need to, once we have identified what are the key risk factors, we need to do capacity building around workshops and trainings. Now, people actually do not want to accept something when you tell them, mostly because they do not know why I should do it. They do not know what is it important, what is it good for me. So there needs to be education, and ArriveSAFE can do this on its own. Our president here, Mr. Harman, needs every one of you to contribute in each and every way you can. We can do something about it. It is within our means. I just would like to share with you that on the 11th of May, this kind of committed what they want to do to make a difference in the country within the 10 years. Like I said from the beginning, you don't have to do something big immediately. You can start off something small. A small deed goes a long way. And if we look at this, something impossible. If you are already in the front line, you know, you're in the limelight, this would be easy for you. Your hands behind your back.
Like this?
Yes, exactly. Right. Now, what I want you to do is, when I count to 3, I want you to fall flat to the ground. You cannot move your hands. You must just fall flat to the ground.
I'm working with the cinema and film industry, not with circus.
Now, I want you to do that for me. This is not about being in a circus, but let's see if you can do that. Just fall to the ground.
Okay, show me how.
I can't do that because I want you to show it to me. Keep your hands behind. Don't move it at all.
For that, I need to go to some road, I think.
No, just here. This is fine.
But he cannot do it without the hands.
No, just show me how far can you go. I want everybody to see what you would do in response to this. Just do it. 1, 2,
I don't think so I can do this.
You don't have to fall exactly flat to the ground. I just want to see how far would you go. Would you touch the ground? Just fall. I want to see your response. Come on your knees first.
That I know.
Right.
You want me to do like this?
Yes.
One more.
I actually wanted you to just fall to the ground. Straight fall.
Should we call a youngster?
Very shooting है.
Who can help us do that?
Very shooting है मैं नासा बनवा के बैठ में.
He's got a shooting, he doesn't want to hurt himself.
I don't.
You will not hurt yourself. Trust me.
You sure?
Yes, you can protect yourself. Just
Okay,
fall.
I can do this also.
Okay, I feel so sorry to see you like this. Okay, never mind. Thank you. Can you do it for me?
Fall here?
Yes.
I won't be able to do it.
Videos about.
What's your friend's name?
Just.
I think you can do it. Just fall. I want you to fall straight like a tree. Fall. Just do that. Just do that. What are you afraid of?
No, he said without the hand you can't fall.
when you're falling, if you need to take off your hands, you take off your hands, but just fall. Please fall. Okay, that is what I wanted him to do. Yes. You want to try now?
No.
Okay. Don't hurt yourself for your show. No, Jess, come here. I want with your hands at the. Were you afraid of hurting yourself? It's dangerous. What did you do when you were falling to the ground? What did you do? You used your hands to save yourself. Right? Yes. Thank you, Jess. So we give him a clap for this demonstration. You go home and try.
Yeah, okay, for sure.
Okay.
I'll do this in
What?
next seminar. No?
Yes. If I'm here again now. Okay. What I'm trying to say is, what do we do?
Let the vehicle take care of
Yeah. Where is this inbuilt safe system that is already inside of us? So in these safe systems, there are barriers for success. Now if we look again at the 5 pillars just now that are this. If we look in road safety management, what are the gaps that are involved? Where do these crashes usually happen? And then there may not be effective enforcement or legislation. If we look at the roads, how are the roads here in Jalandhar? What's your rating? 1 to 5. Rate the roads in Jalandhar. 1. What's the problem?
Have further construction going on?
The engineering.
I'm not sure about how it is like here. When I got in the taxi from Chandigarh to come over to Jalandhar, there was seat belt at the back. But the driver said, no need. You don't have to use. And I said, no, I must. In Malaysia, the taxis have seat belts at the back, but the drivers cut them off, or 5, which is already hazardous. Behavior towards speeding and so forth. And then we have trauma care. Now what I'm trying to say is that in this safe system, these are gaps that allow the movement of energy to come directly and hit us as the road user. So when we fill up these gaps with the use, do you want to say something?
Please go ahead.
Okay, alright. Okay, I'm just gonna quickly go through this one. Now what GRSP does is on behaviors. So when we talk about filling up the holes with good practice, now there are many good practice manuals already in place to address the problem. Of usage of helmets, seat belts and restraints. These are already in place for the use of policy and decision makers. And GR filling up this and giving us a stronger, safe system within ourselves. I'm sorry, man.
I'm sorry, I interrupted.
I have to be interrupted for a while. And I really support having road safety education start. We can teach people, even our young children, what is right and what is wrong. So I will just continue a little bit more to go if you bear with me. What is the Global Road Safety Partnership all about? Now the Global Road Safety Partnership is a hosted program under the International Federation of Countries. Now, they form partnerships at every level, from the global, regional, community and national level. Now what is important with all these different key groups at this level is that each and every one here is not seen as a problem. That's why people don't do anything about it. It is a common misconception that as long as I'm not involved in a crash, it doesn't happen to me, I don't have to be bothered about it. But that is something wrong. Why do we have to wait until something happens, only then we begin to think about the prevention? And then it is important for us to develop a plan, a strategy. This is something I urge each and every one of you. I understand that you come from different organizations, but I strongly believe that within your capacity, you can do something about road safety. And towards the end of the workshop today, we are going to invite you to actually think about how, within your means, from your organization, how can you contribute towards reducing road traffic crashes and injuries? What can you do in the form of education? What can you do within your organization to create awareness? This is something that I want And I would like each and every one of this workshop today. And finally, once come in, we talk about having workshops, we talk about having public education, we talk about improving infrastructure and so forth. And finally, there is a need for us to evaluate and monitor the program. So we don't just think of something and start something and let it go. We start from scratch right up to the end, which involves monitoring and evaluation of our pre and post interventions. Now, I'm going to come to the end, but I'd like to enlighten you a little bit about the Road Safety 10 project. Now, the RS10 is actually Road Safety 10 countries. Now, this project is funded by the Bloomberg Philanthropies, Mr. Michael Bloomberg. He has generously donated a country range, and it is a project spread over 5 years from 2010 right up to 2014. And I'm going to introduce you to the countries. The 10 countries are, we are very lucky to be a part of this RS10 project, to receive fundings in whatever way we can. So the 10 countries are India, China, Vietnam, Cambodia, we have Turkey, Brazil, Mexico, Kenya, and Russia, right? And also Egypt. Now these are the 10 countries in which almost half of the traffic deaths occur in those countries. Now I'm going to introduce you to who are the 6 consortium partners. We start with WHO. Now WHO is the one responsible for the coordination of all these partners in terms of providing technical and financial service in all elements relating to social marketing, legislation, and so forth. And then we have the Johns Hopkins University, who will be involved in the monitoring and the evaluation of these programs in all the 10 countries. And then we have ASSERT, which is the Association of Safe International Road Travel. They are responsible for engaging non-governmental organizations in these 3 countries and also to engage the media to promote road safety. Embark is actually of capacity buildings for all different stakeholders in the identified key risk factors. What we're going to do is through a series of workshops. It can be risk factor workshops around the risk factors that you have just identified. For now, it may be speeding and drink driving, but later on there are many other crash contributing factors. And then we've got social marketing workshop and also first responder training, which relates to emergency response. The goal of RS10 project, the goal of Global Road Safety Partnership, the goal of Decade of Action, the goal of what Mr. Harman is 5 years. Some good practices would have been implemented in India. There would have been some evaluation and monitoring, pre and post interventions, and we would have been able to actually reduce or make a difference in terms of the number of road traffic crashes and incidents in the country. I leave you all by saying that just one thing that I always share with everybody. We are one here individually, but if we come together, we create a model on a biggest level to do something for your community. I leave you with that and I say thank you.